What's really interesting, though, is, I'm curious to hear Dr. Moneme's thoughts on this, too, is the micro trauma of the headers over the years. We've done a lot of studies on chronic traumatic encephalopathy in professionals, but not as much in the day-to-day, like the kids that maybe played high school soccer and then they go on, and live regular adult lives. So that's another really interesting area of research, I think, is that CTE. They call it the chronic traumatic encephalopathy for some, like long-term risk of depression, anxiety, Alzheimer's, dementia, those types of things.
Yeah, Dr. Moneme, what are we risking with that long-term injury?
Yeah, I mean, I think once again, we get so concerned about the big hit and we forget about kind of this chronic subconcussive hits. The football player who trains and practices helmet to helmet every day. And the interesting thing from a physiology perspective is we even know that even these proteins called microRNAs that get secreted in the brain after head trauma. So within a minute after a head trauma, your brain actually starts to change chemically and affect protein production. They've even done studies about athletes over the course of a season and how the protein and how the metabolic profile can change with these subconcussive blows compared to the big hits. So there's certainly some physiology about how these things can remodel and change brain function over time.
Mouth guards, I mean, have we found that to be effective, or is it sort of a myth?
In the last concussion conference in Amsterdam, they talked about the fact that mouth guards can reduce the risk of concussion by 30 to 40%. Simply just limiting head-to-head contact in practices has a really significant impact in reducing concussion. So I think there's value to these different tools. And I think really with these young kids, anything you can do to limit their risk is a positive and a benefit.